We're doing a patient education series on diabetic retinopathy. Everything you need to know about diabetic retinopathy is going to be in the series, so please watch these videos and feel free to ask any question. This is Dr. Anina Abraham from Advanced Retina Care, Hyderabad. What is diabetic retinopathy? When the retina of the eye, which is the nerve of the eye, is affected because of diabetes, it is called diabetic retinopathy. And why does this happen? This happens because blood flow to the retina has come down. The blood flow is compromised, and as a result of this, there are leaky blood vessels on the retina. These cause leakage of cholesterol. Small little pouches called microaneurysms grow on these blood vessels. These break and bleed, and eventually there is a lot of swelling in the center of the retina called macular edema. Eventually, new blood vessels grow on the retina which break and bleed, and this causes a stage called vitreous hemorrhage, and eventually a tractional retinal detachment develops. I've just taken you through the stages of diabetic retinopathy, but you need to understand that diabetic retinopathy happens only in diabetic patients, and it happens because of the duration of diabetes, not just the control of diabetes. You may say, I have maintained my blood sugars very well all these years. Why should I get diabetic retinopathy? Yes, good control of diabetes is extremely important. However, if you have had diabetes for longer than 10 years, you may have diabetic retinopathy even if your blood sugar is well under control. This is the reason why every diabetic is advised to have a retina checkup every year to rule out diabetic retinopathy. More and more screening technologies are coming out to see if there are those red spots on the retina, any dot and blot hemorrhages on the retina, any hard exudates on the retina, any signs of diabetic retinopathy. Diabetic retinopathy is one of the preventable causes of blindness, and unfortunately, so many are becoming blind because of unawareness. They are not even aware of having diabetic retinopathy until the very, very late stages. In fact, there are many who don't even know they have diabetes. They accidentally check their blood sugar at the age of 40 and they find their sugar is very high. They don't even know that they probably have had diabetes for at least 10 years. We have seen so many such patients who have eventually become blind because they don't even know about it. It is very important to increase awareness of diabetic retinopathy because we can prevent blindness due to this condition. Diabetic retinopathy is treatable. However, you must go to the doctor at the early stage of the disease. If you wait till the last stage, the optic nerve gets compromised, blood flow gets badly compromised, and lots of complications start coming. However, if you're treated at an early stage, all this can be prevented and your eye can be safe.